Okay.
Okay. Hello, everyone. Welcome to our second APPIC community call, which is going to be on the third Thursday of every month at 3 o'clock Central Time. Um, Today's topic that was generated by members of the board was to discuss the assessment of baseline competencies in a virtual training environment. Because of the pandemic, so many of our training sites have been disrupted in terms of our usual practices of orienting trainees and getting a sense of their developmental levels as they start their internship and fellowship. And we have all run into some challenges with this process. And so we're excited to facilitate a discussion about how this issue has been relevant for you and to learn from each other about practices that have been helpful in the management of this issue currently. Next slide, please. So just some basic Zoom etiquette issues. Please mute yourself unless you are speaking. If you use speaker view instead of gallery view, you get a thumbnail of just the person who's speaking. We will be typing content in the chat, and please feel free to use the chat box for questions, comments, and suggestions. There is a raise your hand feature that is less helpful if there's a whole lot of people, but at 36, that might be kind of a sweet spot. Our goal with these community calls is to facilitate dialogue among our members rather than to sort of push out information to you. So really, we want everyone to participate and we want to be inclusive. So if we ask people to sort of limit their comments to no more than a minute at a time in order to allow everyone a chance to speak. And as usual, the call will be recorded and on our website. Thank you, Jeff. Next slide. I'd like to introduce our moderators for today. I'll start with myself. I'm at the bottom. My name is Shona Baz. I'm the secretary on the APPIC board, and my day job is to be the training director at the University of Chicago Medical Center. Jeff, you want to go next?
Sure. I'm Jeff Baker. Nice to see all of you here. Looks like there's 47 of you on this call at this point, and glad to see you made it today. I'm the executive director for APPIC and was formerly the training director at the University of Texas Medical Branch in Galveston with our accredited internship and postdoc program there. So welcome, and I look forward to this discussion and catching up with what you all are doing out there.
Very nice to see all of you here. My name is Jairo Kendo Figueroa. I'm an APPIC board member. Currently, I'm a director of training for behavioral health at Salud Family Health Centers in Colorado.
Thank you. So we have, as usual, sort of created a range of several categories that address a range of questions, and we will facilitate a discussion within each category. We really want you all to participate and to hear from you. Don't be offended if we cut you off and say we need to move on to the next issue, but we have 4 questions planned for today with about 10 minutes apiece. And we really want this space to be intended to be one of openness and mutual respect to each other.
Okay. I'll start off here. Again, welcome everybody. Looks like we're up to 55 people now. And would start with this first question here about how are things different at your site as you start the new training year? And I bet that everyone has an answer for this. If you would like to talk, you can unmute yourself and jump right in here. I know things are different because things are different here at APPIC Central Office and how we are managing things, as well as the number of issues that are surfacing early in this training year compared to previous years. So there are challenges. And I hope that you all will be willing to discuss some of those challenges, as well as what you're thinking of, how it's different, so different from last year.
I'm noticing in our didactics, our interns are pretty quiet. And so I tell them that I'm really good at sitting in silence and waiting for them to speak up. So the same goes here.
Yep.
There's some good comments in the chat. So the one that I just saw is we're all virtual. We have not yet met in person. Lots of education and onboarding and more orientation regarding virtual services, interns on site in individual offices, so less shared space. Do people want to address any of these issues? And we would love to hear your voices and welcome your participation.
So I think a big change at our site is all of our group supervision is now done via Google Hangouts, because that's what we use. And I notice as a training director, I'm not feeling as connected to my interns this year and years past, because we don't have that face-to-face interaction. There's not that little like side chat that happens. I'm gonna apologize in advance. I have my nanny canceled today, so I'm actually at home with my twins, but wanted to be here. So it's just that's been really difficult for me, because that's something I really enjoy as a training director, and I think that's really valuable to our interns.
I think that's a great comment, Amanda, and appreciate the reality of you being daycare nanny as well today. So feel free to mute or unmute. We don't mind the noise. So I was on a call earlier today with ASPPB, that's the licensure board people there, and we were discussing the same kind of issues that they're addressing, that some of the states are saying, oh, there's really no difference in this, and we are so surprised that we are going to perhaps consider doing telehealth or telesupervision from here on out. And I made the comment that I highly valued this flexibility and this ability to go to telehealth or telesupervision as a response to a crisis, but I wasn't quite sure yet that it's the same to do it by telehealth. I think there's a lot of similarities. I think it can be done, but I'm not quite sure it's the same, or the nuances are kind of missing there. I'm not grabbing someone for 5 minutes to discuss a case, or somebody's not grabbing me. I'm not standing outside the supervisor's office and discussing what's about to happen, or I'm not sitting in my office as a trainee and another trainee comes in and processes what happened in supervision. So I'm just wondering if those nuances, how different it's going to be, and if it's that big a deal. But to me, it seems like we need to pause before passing laws or licensure rules that all this is fine.
I was just going to say, I think it's also hard to review tape. Like we typically in group supervision review tape, and that's been really hard on virtual platforms as well. And so I think to speak to that issue of licensure, it does make it difficult to get some of that in.
Right. Kristen, you were about to say something?
Yeah, I was going to comment. I don't know if some of my colleagues are on this call, but I know that this is something the VA is really looking at and taking very seriously. And some of my colleagues in Hawaii are doing actual research on the telesupervision. And I think part of what we're going to notice is that there may or may not be differences in training to competencies and competency-based supervision, and we may find gaps in our face-to-face supervision as this research bears out. But I also appreciate what you're saying about some of the intangibles. So there's the quality of the supervision and training, and there's also what are the other things that might be missing. Because I agree with you, the informal times are almost completely eliminated in our virtual landscape. We're all on site, but doing everything virtually. And so we sort of have to create this additional time and space to have the informal communications that we used to have in a much more organic way. So it's
exactly.
much more forced.
I'm just encouraging some caution here, and maybe I'm of the older generation after our presentation a week or two ago about generational differences, and I want to be respectful of new and upcoming folks who are native to this electronic kind of interactions and how life works, but I still think there's some things that we might be missing.
I think there's wonderful research opportunities in this if programs are interested in taking that on.
I like the doorway conversations with PPE. We do get a number of concerns from trainees about people aren't using PPE. I'm scared to death. They say they are, but they're not. And so I don't know if your sites are hearing that yet, but that's one of the changes, that dynamic there of I don't think it's mask versus anti-maskers. I think it's carelessness versus blasé attitude about it. So that's concerning.
Something that I want to mention is the difficulties that we may face dealing with problems of competency, because if we don't know them the way that we knew the previous cohort, that we had that space in the clinics to see them, I think that's another point that we will have to pay attention to, how we're going to deal with problems of competence, or when we have to engage in this very important discussions and we don't really know them so well, or at least we only know them virtually.
Yes. Looks like Francis made a comment exactly like that, saying it's hard to gauge how the interns are doing. They've moved here, they've relocated, and they're far away and living alone. And are they in the quarantine process or the isolation process? But it's hard to gauge exactly how people are doing. And if you remember, interns try to present to you as in a sense of adequacy, and so they don't always open up in that first few months there about how they're doing or how they're not doing.
Our program just this afternoon hosted our first in-person gathering of the year. We had a virtual picnic for all the interns and all the faculty outside. And I really miss seeing so many smiling faces in one place, and haven't seen that for 6 months. And so it was really lovely. And I felt a little bit bad that we haven't done this sooner, or taken the opportunity of the nicer weather to plan something sort of more routinely. So we're going to move forward with doing an event like this every week, and whoever can stop by can join.
So you're physically gathering outside,
Mm-hmm.
socially distancing, inviting people for lunch, and sort of visiting from a distance.
That's what our plan is. We'll see how it turns out. And we're trying to set that up on a day when many of the interns are on site, so they will see each other and us.
And Dr. Holden mentioned some silver lining to the virtual supervision there, giving us more opportunity of seeing what's going on. Most of us never sat in the room during patient contact, but the virtual allows us to do that. So there is something there to put you in the room with that process there. So I think that's the end of my timeline for this part of the question. So I think we'll move to the second question, just to make sure that we have time to get through all of these.
All right, so I think it's very important to discuss now what normal procedures for baseline assessment of trainees' competencies have been disrupted at your site. In other words, how you used to know your trainees in clinically, and how are you doing that right now? How are you assessing those baseline competencies, and what happened? How this has been different? I think that I saw some comments here about, it seems that it's now not so intrusive to be in the room with your trainees because you are virtually. Something that has changed for me has been to see my students and trainees interact with their patients by phone, because the majority of the services that we are providing are by phone. So I think that a lot of restructuring on how to understand their clinical competencies when they are starting to provide services by phone for the first time.
Hi, this is Leah Squires. I'm calling from DC, and just to chime in, I think at our site, being able to assess their baseline competencies in some ways has been enhanced by some of the kind of systems factors inherent in our particular site, because we need to have staff members on the line with any trainee if they're engaged in any care provision that goes across state lines. And since we serve a tri-state area, many of the trainees have to basically collaborate for all of their patient care, or much of their patient care. And so we have a very long process for establishing kind of their competency to do the telehealth. And so that gives lots of observations for the supervisors to make, which has been, for me as a training director, in some ways helpful, because we have more data now than I used to get in the past, because I kind of have them going through a few more hoops to demonstrate that competence.
There are some silver linings in a way where you have multiple sources of data, when in the past it might have been just you.
Thank you so much for that comment. I think that that reminded me the importance on, or different conversations that we have to have with our trainees when they're calling patients and patients are not where they are supposed to be in the location that it's in the chart, which is another training component I think that has been added. And important also to assess on how our trainees are dealing with the patients not being at the location that says in the patient chart.
So I'm seeing some patients virtually, and it gives me a little bit more insight into their living situation and what's going on in their home environments. That makes it a little bit easier to bring those issues to the discussion there. So that would be a silver lining I have found for this.
I will say that the other competency that I feel that it has to be enhanced, or maybe more energy or more attention, has been the aspect of confidentiality and how they are managing when there are multiple people in the room, how they are bringing that conversation to patients when the patients are in the store or in other places, and how they are managing confidentiality and aspects of ethic issues that probably we were in a more controlled environment, and they did not have to engage in those conversations with patients.
How are people assessing their trainees' competence? We used to have them do role plays and those kinds of things prior to starting.
It has been a bit hard to do didactics that include good role plays that we have usually used. That's one of the other comments. I think that it has been a little bit more difficult to find for us standardized patients who are willing to do telephone calls. And I think that a lot of role playing has been the key to establish those baseline competencies and to bring up topics that were not a matter before the pandemic.
It's definitely a different situation. As I was mentioning this morning, I was talking to the licensing board folks, and the assessment of this pandemic happened last March, and so you were 6 months, maybe 7 months into your training program, and you had a much more awareness of your trainees' competence. And so this year, you're starting without that interaction, and you're sort of turning them loose. I wonder if you're turning them loose and their the comfort level with doing that, and how you are measuring or how you're being assured that they are competent to see patients.
One of the challenges we've run into at our site is at the beginning, they do a lot of treatment with their supervisors. So like on our CL rotations and in our integrated care clinics, there might be 2 providers with the patient. And because of social distancing guidelines, some of those options aren't really available. So if you have a patient and a family member in an exam room, you can't have 2 providers go in. And so this has presented as a problem for training at all levels with medical students and with residents, and we're also seeing that with psychology interns and fellows. So direct observation sort of in the moment in more integrated settings. I'm wondering if people have had sort of similar challenges in situations where you're doing testing or where a treatment team is interacting with a patient or a family. There's a comment in the chat about the possibility that the shadowing portion of the services that we provide will last much longer this year, and whether we do that in real time or virtually, it seems like will play out differently in different settings.
I see Dr. Turkle is on this call. I don't want to put him on the spot. I know he's in New York City, and I wonder if he had any comment about how they're going through this assessment process.
Hi, haven't seen you in a while. Thanks for noticing. I think we're also finding it difficult. I mean, what we did this year is we have pretty much a blended presence from the beginning, and we're going to be titrating their presence on campus more as we go through the year, you know, if it permits. So we have been able really to shadow our interns and have them shadow us. So I think it hasn't been as difficult. I think the other part of the question that you were talking about, how do you feel confident sending interns out at the end of the year, that we had that had hesitation a little bit about that last year. And we try to compensate in different ways. One thing we did was got our interns very much involved in providing psychological counseling, psychological first aid to frontline workers in our own health system. So they were able to maintain their clinical work throughout. We also had them perform remote work under supervision. And in some ways, it was easier to supervise because the supervisor can join some of the sessions. As far as testing, what we did was we created a test of testing so that to compensate for a deficit in some batteries, we didn't have as many batteries as we expected. We basically assessed their knowledge. It's not the same thing, but it was a kind of a way of compensating. So those are some things that we were doing.
Great comments. Thank you.
Sure.
I think we're going to move to the next question here, unless there are any other comments.
I'll take this one. What are some creative ways that you and your training staff have implemented to assess the baseline competencies in this world currently? I love some of the suggestions that have already been in the chat about being able to drop into sessions much more frequently, to have trainees tape all their sessions on Zoom and upload them to a shared drive so that they're available for review. I imagine people are watching more tape if that tape is available and accessible. Are there other thoughts that people have at this time?
Hi, this is Fotini Zachariades from the Children's Hospital of Eastern Ontario in Canada. I'm not sure that it's necessarily a creative way, but I suspect one kind of consequence that we're seeing is for the virtual aspects, which would be most of our program, with the exception of the cognitive or the neuropsychological assessment pieces, there's a lot more co-therapy that is happening virtually. So perhaps the side effect of that is that it might take a little bit longer than it would in person for the trainee to kind of evolve into more independence, seeing patients on their own, again, depending of the entry level of the trainee. So I suspect for most of our supervisors, there's a lot more co-therapy to allow for more of that live in-session supervision and conjoint assessment and treatment. And as for the in-person assessment aspects, one way we've worked around it, having the benefit of being in a sort of larger hospital setting, they have been able to establish physically distant and public health guideline ways to be able to do the in-person testing. So simply that larger rooms would be kind of booked for the cognitive assessments to ensure that there is sufficient distance with the youth that is being tested, the supervisor and the supervisee. And that I believe another side effect of that is that some of these testing sessions would have traditionally perhaps been like half a day in length. So to also compensate for fatigue aspects of some of these more distanced ways of doing it, that the testing sessions might be shorter. So I think just everything will take a little bit longer, but that's kind of one way that it's happened in our institution.
Thank you for sharing that. I think that this idea of shadowing and doing co-therapy and working together is again another one of those silver linings that allows for more in-person interaction. And this is happening at our site too, where evaluations are sort of spread over more days and broken up into portions being virtual and portions being in person, and including members of the assessment team, which for us includes externs usually, and in some cases fellows, in addition to our interns. Other ideas?
I think what Fotini mentioned about it's taking a little bit longer, and as we come to that awareness, everything's taking a little bit longer out there, and there are delays, and people still are required to meet your expected competencies, and it may take a little while to get to that level. And there were significant delays in training programs last year, and patient contact, as well as finishing up evaluations. And the reality was, yes, there are delays out there, and we are going to figure out how best to manage those. But it may result in extended programs, extended time before you're more independently providing care to the patients.
I'm wondering, Jeff, if you have any thoughts about this idea that everything takes longer. So one of the issues that we've run into at our program is our interns are very, very busy. They have a full load. They already work a lot of hours a week. And when you're doing virtual services, it just takes longer. There's all of the management that goes around with setting up the appointments, with communication with the patients, with troubleshooting technology, with trying to figure out what's going to work, with sending consents and getting them back and scanning them in, and it's hard. And I feel like there's so much more time that is being invested in this training process that makes the clinical responsibilities feel that much more arduous and hard. And so I'm really trying to think flexibly about like what can give here, because it certainly can't be the face-to-face time, even if it's virtual, but where are the areas that we might have some wiggle room? And I'd love to open that question up. What are your trainees complaining about in terms of them feeling like they're not necessarily getting all of the training that they want in the things that they thought they were coming to do?
Yeah, and just to layer on top of that, Shona, there's so much frustration and agitation out there. I mean, you can go to the grocery store and see it, that it's much higher than it used to be with people's impatience and frustration. So we need to remember our trainees are likely experiencing this as well. And they need to realize that we're experiencing it as well. I like your question. I hope people have some responses to it.
I hope that I'm not the only one in the training community who has interns who are sort of struggling with the virtual nature of doing a job and a half.
Hi, this is Fotini again. My answer is limited because ours just started on September 1st. So one thing that we are doing differently, it's a little bit of a double-edged sword, because you do want to do increased sort of wellness check-ins and these kind of socialization times, but again, they're on Zoom, so it's yet another virtual modality to talk about work-life balance and wellness. However, that does seem to be helpful, and just kind of spent some time on validating and normalizing that everything does take longer, and sort of keeping an eye on that feeling of virtual fatigue, or however we want to term it. But that hopefully in this first month, it's sort of it's an adjustment to the internship, an adjustment to the clinical work, but just making that adjustment process to the virtual modality and all these additional technical difficulties and issues, that's been helpful to just kind of process that and discuss that. I'm hopeful once they have a sense of what their true clinical load will look like, likely not until October. We'll have some more discussions about what else can sort of be lessened, or ways that they can flex their time, that they are also kind of balancing some of that fatigue.
Yeah, it kind of reminds me back to my training program with studying Yalom's group dynamics and this process observation. So it's important for us to make a few process observation comments during supervision or during meeting with your groups, et cetera, just to maybe help people check in and normalize that we're all frustrated, we're all anxious. We were talking before everyone got on the call about how overwhelmed or how burned out we were in terms of being overwhelmed.
I would comment at this point that's in the chat about reminding them that this is sort of life, and this is what it means to be a professional psychologist in a pandemic, and that we're all sort of in the same place. Thank you for that comment.
I think Megan.
Yeah, I was just going to echo your at least in my experience. I'm Megan Gwynn. I'm the training director at Virginia Commonwealth University's University Counseling Services. And you're definitely not alone, Shona, in the experience of frustration. But I would also say that something that's really been coming up lately is a sense of like disappointment and loss. Like they've been able to connect some with each other as a cohort, but both on the staff side of like, we miss getting to really know them. At this point, they started August 10. And they were like, at this point, we feel like we typically have a better sense of them and just who they are personally. And I feel like our interns are expressing that as well, just like this sense of loss and disappointment about the connection they experienced, particularly on like interviews, even virtual interviews, of what they thought they were coming for. And now they're outside of their social worlds and trying to connect. But what I have found has been really helpful is like structured informal time They have given me a hard time, and my staff has given me a hard time as well, because they kind of like roll their eyes when I ask them like cheesy icebreaker questions, but it's like created this like sense of informal kind of what we would be talking about in their lunchroom, and you never know what you're going to get when we are in the lunchroom, but like we usually eat together. We are trying to recreate some of that sense of connection, even though it is cheesy, but it seems to get people started, because that's what we've noticed, is just that loss.
Definitely.
I love the idea of framing it in terms of a loss. Like, what are we missing? What are we losing? And how can we find ways to give this back to you and to each other?
My internship orientation was 40 something years ago, but I still remember when all the trainees went to lunch together more than I did about what happened in orientation. So it was a camaraderie, it was cohesiveness building. And so that was very important to me at that time. I don't think they have that opportunity as much as they used to.
I really like the framework about what are you losing with all of this thing, but also what are you adding that you were not expecting to add. And in that case, I feel that I have been in the need of asking my trainees about what is their relationship with technology and technology that is used to work, and how they are taking breaks during the day. Because I feel I had two extremes: people who cannot get out of the computer, and even in lunchtime that it's expected that they're not going to be there, they're still there, or people who are taking 2 hours to walk their dogs during the time that they are supposed to be available. But I don't think that that they thought about, oh, wait a minute, I now have a different relationship with technology that I had before. And I have to think about how professionalism, that competency, plays a role there. And so I don't know, I think has been a very interesting discussion with some of them.
Mm-hmm. Dr. Simon made a nice comment about how she is struggling with how much to reduce expectations while still meeting requirements, given that it's a slow start and the assessment of how well people are doing is slower. So I know everyone's probably struggling with that.
I run into this with being validating and then trying to engage with them around problem solving and recognizing that I only have control over some components of the internship that I can't change because those are associated with competencies and membership standards and accreditation requirements and licensure rules. And I think that finding that balance has been hard for me as well.
I'm going to move us to the last question here.
Can I plug one thing?
Sure.
So, hi, my name's Nicole Levy. I'm a training director here.
We can't hear you.
Oh, maybe that would help if I move my microphone. Sorry. I'm a training director here at the Vegas VA, and I absolutely empathize with everything everybody's saying. We started internship in July, and we've had our own challenges with our cohort, missing connections to us and to each other and all of that. Something that I think I found to be, or they found to be helpful when I reframed it, specific to VA, so many of our open positions for unlicensed staff, so it's a GS-11 position that they could potentially go into after internship, many of them are telehealth positions now. And so reframing this horrendously challenging situation that we all find ourselves in as but you're going to be so marketable potentially. Like, this is a really good skill set that you're learning that honestly we hadn't really put into your learning plans until we were forced to now. And so yes, it's rough, and there's the learning curve is straight up, but at the same time, in a year at the end of this, hopefully this doesn't go on that long, but who thought we'd be here in September? Think of how great your skill set is going to be and how much broader. So that's like the one reframe that they all keep coming back to, and I'm like, okay, that works. I'll just keep saying that to them.
Not only that, but the option for the folks that don't have anything but telehealth access or can't come into your medical center because of the restrictions. So these patients in need of services wouldn't be getting services without them doing the telehealth. So it's just a different world, I think, and it's going to take some time.
I wonder if there's some sort of format in which we can start a running list of the silver linings, because I'm hearing some of those today that I know are unique, and also experiences that we share. And I'm just wondering if we can find a way to remind each other of some of the things that are not necessarily bad, to shore up each other's spirits as leaders of training programs in this time.
I have no idea how to go about doing that, Shauna, but I love that
Yeah.
idea. As a lover of
Yeah.
positive psychology, take down my name. Let's get in touch. Let's work on that. I'm down to help you with that.
Yeah, like I'm wondering if maybe there's something to run by the board. We can have some sort of like Google Doc or something somewhere where people can post and expand on it. I have to think about it.
Yeah, save my name. Let's get in touch.
Ideas. I put my address in the chat. Please feel free to email me if you're interested in collaborating. Our last question is about the future and the fact that it is September 2020 and this pandemic is a long way from done. So what ongoing challenges do you expect for this next year as you continue to assess your training competencies and what they signed up to do when they matched with you or when they committed to be at your site earlier this year?
This is Fotini again from CHIO. One of my biggest worries, because that's what happened for the last cohort, but we were lucky enough in the last 3 months that we were able to resume some of these in-person assessments. But the part that just cannot be converted to virtual, which is the cognitive and neuropsychological assessments. So in the event that we go back to that lockdown where there is no ability to conduct those because only a certain portion, such as the intake of that, could be done. So it's kind of contingency planning for that really unrepeatable part, even if you kind of have other assessment experiences to substitute for that, it just wouldn't be the same as that formal cognitive and neuropsychological testing. So that's probably my biggest concern in case we go back to not being able to do that.
Hi, it's Laura Jansen at the Hospital for Sick Children in Toronto. Our program has a big emphasis on neuropsychological assessment, and that's a concern here too. One of the things that our more advanced trainees often do during their either fellowship or sort of end of intern and residency experience is supervising more junior colleagues in direct test administration, which is really challenging because we just can't have so many people in the room at once and provide in the moment coaching on test administration. So I think having our trainees develop competencies in supervising others is one that we'll need to think pretty creatively about in the context of neuropsychological assessments.
A couple of really good comments in here about you're already having to write letters of recommendation for postdocs. So it's that would be a challenge if you haven't had any hands-on work with your trainees yet.
It seems like the ability to comment on their flexibility is a silver lining.
Yeah,
you will have a unique perspective on that when you're writing a letter of recommendation.
Maybe want to add that to the profession-wide competencies.
Yeah.
Flexibility.
I think that there are so many things that we do not know in terms of the pandemic and what is going to happen. When are we going to have the vaccine or the immunization for it? So I'm expecting that depending on what is going on in general, that is going to impact our trainees, and we will have to be prepared to support them in everything that is going on. new, for example, people getting sicker now or sick around them, and again having to do accommodations for them. I think at the beginning, and I think that I saw it in some of the comments, that at the beginning many of them, or even now some of the trainees, they don't really want to go to the clinic because they are afraid of it. So I think that we will have to prepare to what happens if, again, I feel that we cannot go back to that stage where we were before, and how prepared we will have to be adjusting to those needs.
And on top of that, a lot of misinformation out there about the virus and miscommunication between our CDC guidelines that we continually reference, and then you get misinformation or misconstrued information, and it's very confusing, especially to trainees who may be vulnerable or have access to vulnerable folks in their living situation. So we just don't have the answers to this pandemic. You get sick and you no longer get sick. That doesn't seem to be true anymore. So that's kind of new within the last month or so, that people are getting reinfected. So it's scary. And so I guess we continue to need to be aware of the changing environment there.
Jeff, if we can move on to the last slide. And we're not quite done yet, but I wanted to bring this to your attention. We're going to have a community chat on the third Thursday of every month at 3 o'clock. The topic will be determined sort of based on our membership's interests. So again, if you have ideas that you want us to talk about, and whether it would be more useful to have a theme where we come on here with some material prepared to facilitate discussion, or to just have sort of a Yalom style process group open agenda, we on the board are open to anything that's going to meet your needs. So please, we want to hear your voices. Tell us what you would like from us and how we can support you. This is just such a hard time for everyone. The other announcement that I wanted to make before people hop off is that on the fourth Friday of every month, we will have a webinar for which you will usually get continuing education credit. I don't think that this one on the 25th comes with CEs, does it, Jeff?
It does not.
It does not, because this one is going to show you our new APPIC platform. So as you know, the APPIC was converted to a new digital platform this year, and the interface is going to look completely different. It's going to look more like the postdoc application system. And so Dr. Kimberly Hill, our APPIC online coordinator, is going to be doing some demos. And we, in theory, the training directors are the stakeholders who are going to most benefit from this platform, because it comes with lots of bells and whistles. So I'm really excited to learn about how it will help with the internship review process. And I hope that you will all join us next Friday at 3 o'clock Central Time. But Jeff, you can stop the share and maybe we can just open up to see if people have thoughts, questions, ideas for future programming. We have about 10 minutes left.
I was just going to say one other silver lining is that APPIC has never done these before this last year, this last 6 months. And so it's really given me an opportunity to see firsthand and hear from firsthand from training directors. And I do on a regular basis, but not to this degree. So it's been really nice to have this silver lining that it brings the community together and opportunity for that. And I'm hoping that people feel supported or feel that this is a resource for them as well.
Any ideas for topics for next month?
I had an idea. Brooke Guerrero here from West Coast Children's Clinic in Oakland, California. And one thing on my mind is the West Coast and here in the Bay Area just getting hit with the onslaught of fires on top of COVID. Yesterday was the first day it was even safe to go outside and breathe the air, as though we needed any more stressors in life or sense of isolation to our interns and trainees, that now we couldn't even go on walks. So one of the topics on my mind is just sustaining morale. And I know that we're all, excuse me, I have a virtual learner behind me, distance learner, we're all managing our things. So just thinking about creative ways to sustain morale. I know this is kind of a theme throughout these conversations, but it would be really helpful to me to hear, it's always helpful to hear what other sites are doing to build community and yeah, support each other.
Thank you, Brooke. That's a wonderful idea. Any other?
Yes, burnout management. Sorry, burnout management. That's kind of similar.
Burnout, morale, problem on top of another problem. I think that I can relate with that, and other places in the region experiencing specific problems. And I think that it's important to see how, you know, we incorporate those things in the process. I can remember, you know, for example, some trainees from Puerto Rico experiencing their family members' earthquakes, and how do you manage that on top of the pandemic and on top of everything else that is going on? So I think it can be a very interesting topic. Thank you.
And don't forget our friends and training programs in Mississippi and Georgia and Florida, who with the hurricane issue that just went through there yesterday, and I think is still lingering in that area. So lots of disasters. Those disasters, hopefully we can recover from quickly. This pandemic is a little bit different. And so you put one on top of the other and it's very, very stressful.
I'm looking at the suggestions in the chat, how to have internship programs, so how to create networking among programs that are similar to host relationships and support trainees. Other suggestions are establishment of MLAs that are acceptable to APA, planning for training while navigating institutional and APA, APPIC state guidelines during the changing nature of the pandemic. We would love to hear from you. So again, feel free to email me. And I like the idea of burnout management and keeping morale up for our trainees and for each other as we head into October and application deadlines, and sort of bracing for what is going to be the next season that will place a lot more burdens on us to think about doing things differently. So I don't know about you, but it keeps me up at night wondering how I'm going to make slideshows and videos and do virtual recruitment.
Yes, I worry about that too. It would be our first time doing a full-blown virtual one. We've had the odd telephone call, but the other worry at the back of my mind with our current cohort, at least we were able to do our interviewing process in person. So there was still a small feeling of familiarity and that sort of personal connection. I'm concerned about this new cohort, whether just the selection will be the same. We're missing out a lot of that nonverbal interpersonal interaction that would have just organically happened during our luncheon. So there's no substitute for those aspects, no matter what you do virtually. So I am just worried about, you know, who we will select, will it be the same as other years, and just not having that initial in-person connection even from an interview. It's kind of setting us back one step even more behind than the current cohort. So
Zoom can definitely be stifling to spontaneity. So you do lose that. And so it'd be interesting.
But we are almost at 4 o'clock. Thank you so much for joining us. We're very glad to have you all here. I love seeing people's names and faces when you share them, and to feel connected with my colleagues, because we're all colleagues, and no one else gets the job that we do except each other. And so this is, I think, something that is usually unique to the APPIC conference. And I appreciate, my silver lining is that we get to do this every month and to see you every month. And so thank you for being here.
Thank you, everybody.